All right, so I'm going to try to do this in under 5 minutes, but you can always fast forward me if I get too slow. So this is a list of 9 mnemonics that I tried to organize in a way that was easier to remember and associate what mnemonic went with what. So I've listed under 4 categories: assess. We're assessing signs and symptoms. Why are we assessing signs and symptoms? We're trying to predict for complications. And then if we see signs and symptoms that predict complications, we're going to try to treat. So that kind of makes sense here. Just going to linear progression through here. The first one under assess is going to be you're going to preoperatively, so that's what the P stands for, check your ASA. In this scenario, ASA stands for aspiration precautions, which would be prokinetics and H2 antagonist. And then you're going to individualize sedation, so push to effect. You're going to make sure you have a 20 gauge access. And then P for pre-op actually stands for PCV. So that's making sure you have pressure controlled ventilation in case you have a bronchospasm or air trapping and you want to limit your pressures. And then what else are we assessing? This kind of bleeds over, this one bleeds over into signs and symptoms, but we're assessing for risk factors for acute lung injury. So that will include pneumonectomy and chronic alcohol use. And we'd want to be judicious with fluids intraoperatively to limit acute lung injury. And then the rest of these are kind of self-explanatory as long as you can read my handwriting. So we wanted to know, what is their exercise tolerance? Are they a smoker? Do they currently have a cough? What is the reason for the cough? Infection versus smoker's cough, I guess. Versus cancer. If it's hemoptymus, it might be like an endobronchial tumor. And then for the last one is dyspnea, and dyspnea carries over into the next column, which continues signs and symptoms. So we're assessing for DWD CVP, so decrease, wide diameters, cough, and visible use of intercostal muscles and pursed lip breathing. So some of these repeat because some of the PowerPoints repeat, and it's all kind of I don't know. It's not clear cut. It's not well compartmentalized. So that's why we're doing this right here. And the last thing that we're assessing this down here is more relevant for asthma. So you have those 3 cell types that are mast cells, eosinophils, and macrophages. They release mediators such as histamine and leukotrienes that result in increased secretions, increased alveolar capillary permeability, which increases edema, and then you also have some smooth muscle contraction. The 2 ones that I circle, the 2 letters that I circle right here, are just filler letters to make the words a little bit more pronounceable or familiar. And then next is going to be complications. So of course COPD. This mnemonic spells COPD, and the first one is COPD. Next is OLB, poor general health, and diabetes are all indicative of complications. And then for cardiac complications, you are also going to be at a higher risk if you have arrhythmias, MI less than 6 weeks, and then unstable angina. And I've tried to make this spell ambu here, since my handwriting is bad enough to where my B's kind of look like 6s. So that's what I did with that one. And then the last column is going to be COPD as well. So since the second listed COPD, I have a 2 here, and the real reason is because there are 2 C's. So there is a cessation and a corticosteroids, and then you're going to have oxygen, and you're going to, with that oxygen, you're going to keep the PaO2 60 to 80, and then you're also going to use dilators. And I guess we could also, there's a different ones that I don't have it worked into here, but there's also broad spectrum antibiotics and diuretics in here as well. I don't know how to fit that in. And this right here, this is actually that picture that shows the dilation of the airway, and it kind of looks like a vacuum or a turbine or something like that. But the first step is cessation, and I don't have that listed here because it's kind of it's kind of, again, kind of redundant with some of the other slides, but cessation would go in here, and then the end would participation. So both of those are kind of education related, top to bottom. And then in between, you want to use direct laryngoscopy in order to see the rhinoglottitis. which is what the R stands for. So it actually stands for dilate, loosen, and release. So you're dilating with bronchodilators, you're loosening with fluids, and then you're releasing with CPT, coughing, and I ran off the page, and then postural drainage, which I don't, you get the point. And then this is the actual treatment, the pharmacologic algorithm that he listed, the 1 and then 1 plus 2 and then 2 plus 3. And so those are, I arranged that to, or actually it kind of arranged itself to spell Silic, like Silic maneuver for bronchospasm, except it's spelled a little bit different. So Silic instead of Selic. The S is SABA, inhaled corticosteroids, LABA, leukotriene inhibitors, immunomodulators, such as omalizumab, and then a glucotriene, of course, would be the, I'm trying to blank on that. Anyway, you guys, you know which one it is. And then the PO corticosteroids are, of course, last. And that is it. Let me see where my time is at. I'm at 6 minutes. Shucks. A little bit longer than I intended to be.